Well, you know, if you haven't seen Kyle's forecast, you'll see it in a little bit. One word to describe it, and that would be hot, because, I mean, temperatures are increasing. They're about to shoot into the hundreds, it looks like.
It's not even officially summer yet.
I know.
Well, yeah, tell that to you and your body when you get outside, because
No
it
kidding.
is. And a lot of these Texans, again, you got to be careful here. You get our 98% humidity combined with 98 degrees. It can be downright deadly if you're not careful.
Oh, absolutely. Lots of good tips to help keep us safe this summer. Dr. Luis Fernandez here with Trinity Mother Francis, here to give us some tips on how to stay cool and safe in the summer heat. Thanks for being with us.
Stay inside in the AC, right? That's
Yeah,
about the best way.
That's the #1 tip right there.
Oh, gosh. Again, this is, we preach this every year, and every year, obviously, you have people come into the ER who are suffering from heat prostration, heat stroke, heat exhaustion. What to do?
Right.
Well, the most important thing is to try to limit your activity during this environment. As you mentioned, high humidity, high temperature puts you high at risk. Also, the extremes of age. If you're very young, very old, or if you're a very athletic person, for example, and engaging in athletic activities during this time of year, you have to make sure that you hydrate well and recognize some of the signs and symptoms that you'll be experiencing.
If you start to notice yourself experiencing some of these symptoms, first of all, what are the symptoms? And if you start to notice them, what should you be doing?
Well, the more common symptoms, for example, are muscle cramping. That's usually due to low volume, due to fluids and electrolyte, particularly sodium. You may also feel dizzy, nauseous. You'll find profuse sweating, and that's usually in the early phase of hyperthermia, which is this overheating process. And you can find several of them, including shock. Once you become extremely elevated temperature, up to 104, 105, you begin to hallucinate, and you may subsequently go into a coma. That is a medical emergency. The smaller ones, the earlier components, such as muscle cramping, can be dealt with stopping what you're doing, getting yourself to a cooler environment, cooling yourself off in myriad ways. When you start to experience this temperature elevation to the extreme where you no longer sweat anymore, when you're beginning to hallucinate, when you see your behavior being abnormal, you need to seek medical attention rapidly, because that can be fatal.
Absolutely.
Again, East Texas is a huge retirement community. This is certainly a problem with older East Texans, as you mentioned, obviously infants, but older East Texans. And this is something that you guys, this is not a rare thing. You guys have people come in with this all the time now.
Right, we do see that very commonly, and as you mentioned, and when you look at the older patient population, particularly if you have hypertension, diabetes, puts you in even higher risk for these things. Factors into consideration before you engage in any of these activities at this time of year.
Wouldn't hurt this time of year. Maybe make a call over to Mom and Dad's place and see how they're doing. It's grandma and your grandparents, or if you have older parents, just to check, make sure they do have, they're keeping cool, because it doesn't take long for this to happen.
That's
Absolutely.
right.
Yeah. And if you're gonna, I mean, obviously you can't avoid being outside entirely. If you're gonna be outside, what should you sort of do to
Well,
prepare yourself?
one of the things that you need to do is to act proactively. In other words, make it a habit of every 15 minutes or so to drink a significant amount of fluids, whether it's an electrolyte fluids, or Gatorade or something of that nature, or some form of clear fluid or juice. Do that every 15 minutes or so. And you're talking about a minimum of 300 cc's, a large cup of water or something of that nature. That would be helpful. Make sure that when you start to feel the first symptoms, you start to feel tired, that's your body giving you a message, hey, we need to back off of this thing for a little bit. Most of us are pretty aggressive. We want to go out there and push through this, and no pain, no gain, that kind of thing. Up to a point, that's okay, but you need to be aware that there are environmental issues here that are beyond your control.
Absolutely. Well, some great tips and great timing, because we are the mercury is climbing. Yeah,
we're there.
Yeah, we are there.
Dr. Luis Fernandez, thanks for coming. Always good to see you. Stay cool.
My pleasure.
Try to.
You bet. Thank you.
Thanks a lot.